Hi everyone, welcome. My name's Mark Williams,
Yeah, and hi everyone, I'm John Fox.
and together we're the editors of the new book, Feeding the Self, Identity and Recovery in Anorexia Nervosa. So, yeah, thanks very much for joining us today. As part of our book launch, we're um, really wanting to talk to one of the people who contributed a chapter to our book. And rather than just introducing the chapter ourselves, we wanted really the opportunity for people to hear directly from some of the people that are behind the work. So the thinking that went into the chapter, some of the evidence behind the chapter, and what it means really for understanding anorexia nervosa. So we're delighted really today to be joined by Dr. Kai Thomas, who is a healthcare research Wales Advanced Fellow in the School of Psychology at Cardiff University. And Kai's researching eating disorders and particularly improving awareness and understanding and support for eating disorders in gender diverse populations as well as neurodivergent populations. So Kai brings together people with lived experience, clinicians, researchers to better understand these intersections and as well as the barriers that people face in accessing support. I suppose without further ado, just like to say, Kai, it's a real pleasure to have you joining us today. I suppose I'll start just by asking you, what led you to do research in this area?
I'd just like to start by obviously thanking you both for inviting me to contribute the chapter, but then to have a chat about it today. I suppose my PhD research probably is where my interest in disordered eating started, it was focused more on sort of behavioural and neural markers of cognitive control and how they're related to disordered eating in pre-adolescence. And I sort of, as I was going through the PhD, realised that there was actually a sort of disproportionate burden of eating disorders in particular populations. So underserved communities like trans and gender diverse people and neurodivergent people. And really, we still didn't at that point have a lot of research focused on those populations. So I sort of started to think, how could we do more research in this area that will really improve things for those underserved groups, and combined with my own lived experience as a trans person who's had an eating disorder, it really sort of pushed me towards trying to, I suppose, make things better for trans people who are experiencing eating disorders. A combination of my own lived experience, but then also sort of seeing where gaps in knowledge and understanding were, and I suppose areas where we could do more to help people.
Mm-hmm. Well, I mean, first of all, you're extremely well placed to be researching this, obviously from a combination of your, academic background and your lived experience. I guess what comes to mind for me is what that's like to do that research with those kind of different perspectives.
Yeah, it can be, I suppose there are positives and challenges. Positives in terms of having lived experience and being able to connect with participants in a way that I think helps build trust. And I think it puts people at ease when you are able to share that part of your life. And obviously everyone's experiences are so different, but just being able to sort of say, like, you are safe talking to me about this topic for people who are part of marginalized communities. So I think in terms of building trust, it is really it is a real positive being able to sort of understand more about people's lived experiences and pick up on nuances that I think are quite, are more difficult to pick up on if you don't have that experience yourself. But then there are challenges. I think I'm in a privileged position where I'm a researcher who is conducting this research. I am a trans person, but I transitioned 15 years ago, and I'm often working with people who may be experiencing eating disorders at this point in time, or they may have previously experienced one. And they could be, on the waiting list for gender affirming care. So I feel like there can be some challenges around trying to sort of navigate power imbalances, and also sort of having having different experiences with accessing gender affirming care, which can be like a really emotive and distressing thing for people to talk about. So I think there are many different layers to it, but those are sort of what comes to mind.
I just wanted to follow up, Carl, if that's okay. Now, I've got no wish to put you on the spot for your own experience, so please don't feel you have to answer anything you're uncomfortable to. But I'm curious about where we started today, which was you talking about sort of gaps in understanding and gaps in sort of services. And I just wondered if there was something about your own experiences through services that were also an important driver for you in doing this work.
I think that's a really good question. I suppose for me, my experience of an eating disorder and accessing eating disorder services was it was before I transitioned. So I was actually accessing eating disorder services, and as I was sort of, I suppose, further in recovery from the eating disorder, I then started to explore other aspects of my identity, one of them being gender. And that is actually something that, is part of the research that I've done so far, where we've been interviewing people who've had eating disorders and who are trans and gender diverse. There is a lot of variability in terms of whether people have accessed eating disorder services before or after they've started exploring their gender. So yeah, for me, it was something that I started to explore later on. I suppose, again, I was in a fortunate position, I think, where I had seen I'd been admitted to CAMHS fairly early on in the process, and I was able to get support early. And I know obviously that's not the case for everyone. So there was definitely an element of sort of spotting that there was a gap in terms of people being aware of trans people within CAMHS services. I don't know whether that was 15 years ago. I don't know whether that was really something that they'd come across before. But yeah, I think trying to navigate some of those services as a young person who also didn't know like what the process was, and and sort of often having to try and educate professionals that I was interacting with was quite challenging. And I think that again has come up in some of the research that we've done as well, around people's experiences of services.
I just want to say thank you for that. That's just really, really interesting, and it really helps to give a context to so much of this really sort of important work.
Yeah, I echo that really. I think it's so generous of you to share your experiences, and really interesting to hear that obviously you're finding some similar things in your research as well as additional things, I'm sure. I suppose I wanted to follow up on, educating, people and clinicians. I guess that's, what we're hoping the book will do in part. And first of all, I guess I'm interested to know from your experience and from your research what some common kind of gaps in understanding or even misconceptions might be in clinicians.
Yeah, so I suppose previous research has also looked at sort of clinicians' perspectives on providing eating disorder support or treatment for trans and gender diverse people, but also trans and gender diverse people's experiences of accessing treatment and what that has been like for them in terms of accessing eating disorder treatment. And I suppose a combination of what other researchers found and then what we've found in some of our preliminary analyses is that I suppose one of probably the most common misconception is that gender dysphoria is the only driver of eating disorders in trans and gender diverse people. What we actually see is that it is a lot more complex than that. We have spoken to some people, and we've got qualitative insights from a large survey that we conducted, where some people have talked about gender dysphoria being a large sort of, or a driving factor in terms of their eating disorder, whereas other people have actually said gender dysphoria wasn't something that I felt was linked to my eating disorder in any way. And actually my eating disorder was driven by, these factors instead, whether they were sensory differences, whether they were more a case of like discrimination or social pressures. So it is a lot more complex than just gender dysphoria. And I think what people often say is that either the gender dysphoria is assumed to be the only driver, or it's not assumed to be linked at all. So people are often trying to explain that actually, yeah, it is a lot more complex than gender dysphoria, although that may play a part for some people.
It's really interesting, isn't it? Because as you say, often the message is that it's often about trying to use eating, trying to find the right way of putting it, almost like an eating disorder behavior to achieve what is perceived to be a particular body shape or a particular gender, shall we say. But actually what you're sharing is a lot more complexity to that. It's not just, there's a factor perhaps of that, but there are these other intersections that are also going on here.
Exactly. I think something that's come up in research that we've done is that, yes, people talk about, I suppose, social pressures in terms of wanting to align their body with a sort of appearance ideal that we may talk about in terms of cisgender people as well. So for trans men or trans masculine individuals, wanting to align with more of a sort of lean and muscular body shape. For trans women or trans feminine people, it may be that they want to align their body with more of like a curvy shape, or even like a sort of a more thin body shape. So there are a lot of nuances, and that is without even talking about non-binary people or people who may identify with a gender that sort of exists like between or outside of the gender binary. So for non-binary people, they often talk about an androgynous appearance, and that is the ideal that that they're striving for, which again can look more like or can be driven more by some restrictive eating in order to reduce body fat. But there are a lot of differences as well. So it is a lot more complex than just saying people are trying to achieve a certain body shape. Yeah.
You mentioned, some other factors, and one thing I heard was sort of social pressures. I suppose I wondered what kinds of things that might involve in gender diverse people.
So I suppose social pressures can mean several different things, really. One of them being the sort of social pressure around appearance, so appearance ideals that we were just talking about. I suppose social pressures in terms of having to fit into a certain gender category. So for non-binary people and gender non-conforming people, not feeling like they sort of really belong in terms of the way that a lot of the world is set up in terms of binary man and woman, male and female. So I think for non-binary and gender non-conforming people more generally, trying to find that sense of belonging in what is really quite a sort of cis-normative society where a lot of things are set up in that sort of binary way. Yeah.
Services included, I guess. Yeah. What do you think? I mean, this is not a question I'm expecting to have like a clear answer to. I'm sure it's quite complicated, but I guess I'm wondering if you have any thoughts on what gender affirmative care would look like, given what I guess you've found from people about their experiences of services.
Yeah. So I think there have been suggestions in previous research as well. And I think in terms of what we found, there are quite small steps that people could take to create a more sort of welcoming and safe environment. So, including pronouns on email signatures. We've had people often say seeing an email or some contact come through from a clinician where they've included their pronouns is a really sort of useful signal in terms of feeling like, okay, maybe this is going to be a safe space. To also say that I think a lot of trans and gender diverse people, but I'd probably extend this to people who identify with a marginalized or minoritized identity. They often are hypervigilant, looking for signals about whether this is going to be a safe interaction or not. So people have also told us, being upfront early on in terms of what people's name and pronouns are, and making it clear that those are going to be on the system and they will be used, because people have talked to us about, and I know I've had experiences myself where you're expecting your name and pronouns to be correctly used, and then you turn up to an appointment and it's not been noted down, and then you're called from the waiting room with your old name. So that in itself can be
it's not a good start to a therapeutic relationship, is it? Yeah,
exactly. So that it's trying to build up a sense of trust and rapport, and even I suppose even just showing that you are willing to learn more, and that you are taking steps to improve your knowledge. If this is something, if gender identity or gender diversity is not something that you've had experience with before, just showing, I suppose, the effort that you are willing to learn, because a lot of people have told us that they've had experiences where they have often been the ones having to educate their clinician. And it can be really, I suppose, it can be really frustrating, but also demoralizing if you've gone through the process of being on a waiting list. You get to that appointment, and then you feel like you're the one who's having to educate the person who you're expecting to be able to help you. It can be really difficult. So those are some of the main things that come to mind. Again, they are quite small steps, but anything you can do in terms of having some signals early on that this is going to be a place where people are going to be safe and accepted, is really helpful. I've been to GP appointments where I've seen like a pride flag or a trans flag sort of just up in the room, and it doesn't have to be something that someone's chatting about, but just those little signals that I think are really useful in terms of just making you feel more at ease.
And I guess that what you're touching on there or alluding to is just and you mentioned this in the chapter, is just the amount of stigma, discrimination, just outright prejudice, which is still out there. And actually, it makes perfect sense in what you're saying. That actually, just looking for those clues, those signs that you are a trusting and safe person. It may well be that there's a bit to learn, and you need to sort of think a little bit with that person, but just having that space to be able to think like that feels really
important.
Definitely. It's so interesting the point about pronouns, because I was also thinking it's can be quite contentious, can't it? There's that idea that some people really don't like even having to state pronouns, and it's nice to hear a concrete reason where actually in this context it makes a lot of sense, as a way of signaling for safety. It sort of makes me think of things like lanyards as well, which I don't know if that's the kind of thing people mention too, but I've certainly found it to be the case, with sort of sexual minorities. For example, if I have a rainbow lanyard, I have gone from one session, someone not being open, and then me happening to wear the lanyard, and actually a lot coming out that I didn't even ask about. But it sort of frees people up, I think, when there are those safety signals.
I 100% agree. I think again, it is just those small steps that do make a big difference in terms of people feeling, like you said, open to talking about things that they may be quite closed off from discussing, if they're not sure if this is going to be a safe environment or not. So even those small signals can be really powerful. And I think once you've been able to have that first discussion with one person that you trust, that in itself can be a really powerful thing in terms of being able to verbalize how you're feeling. And a lot of trans people have talked to us about finding it really challenging, to try and sort of work out if what they're feeling is linked to the eating disorder, if it's linked to the gender dysphoria, or if it's linked to neurodivergence or something else that's going on for them. So just being able to have that space to start those conversations, I think can be really powerful.
That's so interesting.
It is. Can I go on, Mark? Sorry.
No, it's okay. You go. I'll come back to it.
I was just actually, it's interesting, isn't it, how we've ended up sort of segueing straight into practice and some of those things. And I just wanted to take, if it's all right, Mark, just to sort of bring us back to the chapter, because you've already touched on quite a few sort of themes, and I just wondered if there was anything else that would be useful. I suppose it's about sort of sharing for those who haven't read the chapter. What do you think are the key messages? What do you think the key aspects of the chapter are?
Yeah, I think so. I suppose one of the key messages for me from the chapter is around the prevalence of eating disorders in trans and gender diverse people, and how disproportionately burdened they are by eating disorders compared to cisgender people, which, I think people are sort of aware that there's an increased risk, but not necessarily to the extent that there is. So in the chapter, I have included some prevalence rates, but also tried to sort of break it down in terms of, this is what we know in terms of people self-reporting an eating disorder diagnosis versus what we know from specific studies where we've looked at more of the clinical diagnoses. But I think the other key message really is around how this burden is also amplified in terms of specific trans and gender diverse groups. So often we think of trans and gender diverse people as one group or one community. Research is now starting to look at, say, binary trans identities, so like trans men and trans women, compared to non-binary identities, like I mentioned earlier, and trying to understand, like, what are the experiences of individuals in these specific groups. Because when you think about, I suppose, identity within binary trans individuals compared to non-binary trans individuals, you can see where there's going to be a lot of differences in terms of, for binary trans people, often you are aligning your appearance and your identity with cisgender people, so cisgender men or cisgender women. For some people, that's not what they want to do, but for others, that is. And there is an element of wanting to pass in society as your authentic gender. And I think it's a very different experience for non-binary people who, because they don't conform to the binary expectations around gender, they are more visible in society as being part of that minority group. So I think, I can't talk on behalf of non-binary people, but I think there are differences in that experience of belonging and visibility and safety that we don't necessarily see in binary trans people. So I think, in terms of the prevalence rates, but also understanding prevalence rates across the different gender identity groups. The other key message, which I think we've touched on already, which is around the complexity of that relationship between gender dysphoria and eating disorders, and how there are a lot of misconceptions in terms of what is driving eating disorders in that group. And then the third one, again, I think we've touched on this a bit already, but the importance of clinician competence and confidence in terms of supporting trans and gender diverse people with eating disorders. So again, not underestimating the power of small acts and how they can be really helpful in terms of creating that sense of safety and belonging.
I think, thank you. That's really, really helpful. Almost like just to provide some of the themes that are so well put across in the chapter. And the one thing I wanted just to reflect on, which is, in a sense, the theme of the book. So, the theme of the book is about looking at identity, and it's fair, Mark, isn't it, that we came to this sort of book by thinking a lot of our clinical experience and sort of research experience, sort of highlights that when an eating disorder starts, right in those sort of early adolescence, it happens at the time when we're all trying to work out who we are and how we fit into the world, and sort of an eating disorder, almost like a ball running through the middle, sort of takes over and often can lead to how somebody ends up defining themselves by their eating disorder. And there are many examples of that through the various chapters in the book, different angles. But what you're describing, I think, through your chapter and indeed now, is a really complex picture of sort of gender diversity, eating disorder. And I just wondered a bit about the impact then on identity development. You know, what your sense is there from the literature.
I think there's a really important point, because I suppose we know that in terms of what you said about identity development in adolescence, and we know that trans and gender diverse people start to explore their identity and their gender identity at many different points throughout their life. I think there is often this assumption that if you didn't know that you were trans as a child, then why is that? Like, you should know early on, when actually people do start to explore parts of their identity at different points. So I think in terms of identity development and eating disorders, what I did want to touch on was, I suppose, thinking about how the eating disorder sort of may emerge as you are starting to try and explore your identity, or maybe you're not able to verbalize challenges around exploring identity, but actually how it may, for some people, become sort of a clearer or more coherent identity that they then start to explore. And actually the gender identity is not something that comes up until later on, once they started to recover and move away from the sort of anorexic identity. So we have had people in our research talk about sort of wanting to position themselves, or I suppose wanting to gain a sense of control from the eating disorder, which allows them to feel sort of better able or more in control of their life, but also in terms of having that sense of belonging that they were missing in their life previously. So if we think about people who are unsure of their gender identity, they may start to think that actually something's not right for me, but I don't know anyone else who is trans or gender diverse, and I'm not sure if this is even a possibility for me. It can cause a lot of distressing feelings when you feel like you are different and you feel like you don't belong. And then, I suppose the opportunity with an eating disorder to have that sense of control, have that sense of predictability, and sense of belonging, I think can be really important. And I know there's a chapter in the book around social identity, which again I think overlaps a lot with some of the points that I think are really important for trans and gender diverse people around access to social support, which again for a lot of trans and gender diverse people, if you're not if you don't have a friendship group or social group that also includes trans and gender diverse people, often it can be really isolating and lonely. And we obviously know with eating disorders, it can isolate you further and be a risk factor. So I think there is a really important element there around social support and how important building meaningful social interactions are in terms of eating disorder recovery. Sorry, I rambled with that one.
No.
That's really interesting.
It's really interesting. What I was reflecting on is just how much that is across so many of the themes in the other chapters.
Yeah.
This sort of notion of connection, notion of having sort of social networks, being able to move beyond, as it were, one's eating disorder. And actually, you're slightly different nuance, of course, but you are touching that, and that feels really quite profound, and very much in keeping with the other chapters.
Yeah, it's so yeah. I feel like there was so much in what you just said that could spark, yeah, a host of probably other webinars just to unpack them. But the the topic of belonging is so is so key, I think, in eating disorders generally speaking. But also I think what I've heard from people in kind of my clinical work, it can also get in the way of belonging. And anorexia can have that kind of effect of suppressing emotion and suppressing expression and authenticity, paradoxically, as well as being a way of coping. I guess I'm wondering about, if you have any thoughts on that.
I think, that's a really interesting point because, when we're thinking about, I suppose, connecting with other people and how important that is for recovery, it was making me think, I suppose, in terms of coping with gender dysphoria and sort of suppressing. Sorry, I've started to think of several other things. Let me just work out what line I'm going to go down. Sorry, could you repeat the question, Mark, please?
I was thinking about how, almost paradoxically, there might be a drive for belonging, and in some cases, anorexia is a way of coping with that feeling, but that anorexia itself can sometimes actually, in suppressing feelings, actually make it harder to belong, because there's, I guess, less authentic expression. There's less of the things that actually allow people to connect socially. Just wondered if you had any thoughts on almost that paradox, if you see it that way. It's just something I thought about and seen clinically.
I suppose it hasn't really come up in directly in the research that we've done with trans and gender diverse people, but it did make me think about my own experience and how I didn't necessarily notice that was probably happening, but I can see how it was. I think when you're experiencing the eating disorder, it can be other things outside of your control that mean that you are isolated from other people. So whether that be, inpatient support or more intensive outpatient support that sort of take you out of that like daily life. So the thought that I had was actually, I feel like there are often other things that are in the way in terms of keeping some of those social connections going. Like I wasn't allowed to be in school, so I lost that sense of connection with people my age. I'm lucky that I have a twin sister who was obviously able to, I suppose she sort of facilitated some interactions with other people. But actually that was still, when I think back, I don't know how engaged I was, if at all, in terms of social interactions, and building those connections sort of outside of the eating disorder. I think one of the main reflections I have during that time is that I can often not remember what was happening during that time, because during recovery your days become so regimented and focused on the eating disorder and what meals you're going to be eating, or this is in the context of anorexia treatment. But yeah, your days become so consumed by what is going to be on the meal plan, and like I said before, often you are isolated from sort of your daily life and social relationships. So it often just all sort of merges into one. It's hard to sort of remember distinct events during that time. So yeah, that was a very long answer, but I think there are like complexities in terms of thinking about the social connection.
I mean, it's just interesting how treatment in and of itself can interfere, I guess. And understandably, obviously it's intensive treatment, has its place, but broadly speaking, that social kind of route to recovery is important, and it's just interesting to hear you relate that as well to gender identity. And I guess the sort of the cultural backdrop around that. I guess it brings me back to stigma, and the role that could have in sort of making it or interfering with gender diverse people's opportunities for authentic expression.
Yeah, that's a really interesting point. I think it can be so individual in terms of what access people have to support networks. There are some people who are really well connected in terms of the trans and gender diverse community, or the LGBTQ plus community more generally. So there are people who have a lot of social support that they get from those groups, and they really strongly identify with those groups as well. But then there are people who, maybe they live in more rural areas, or they're disconnected for other reasons. A lot of people join these communities online. So I think there are people who don't have those strong social networks, that then struggle more in terms of forming, I suppose, more of those authentic relationships with other people who've experienced what they're experiencing. And because of the broader social cultural background and the levels of stigma and discrimination, it's sort of going back to that point that we raised earlier in terms of safety and sort of being alert to signals that are going on. And I think that's why a lot of the time people seek out specific trans and gender diverse social groups, because they feel like those are going to be safe.
Yeah, if they exist. I mean, that's a really good point, isn't it? About, clinicians, what I think will find that really helpful to recognize that, the importance of community, of course, but also that it's not always available. And that's going to have a geographical component to it as well, as you say.
Yeah.
But then sorry, go on, Kai.
I was just going to say, and for some people, it may not be that they specifically seeking out a community in terms of trans and gender diverse people, or people from the LGBTQ plus community more generally. It may be that they have a group of friends, or they have the family network that are able to provide that support. So yeah, I suppose it goes back to the point. It is very individual in terms of what people specifically need and want.
I mean, yeah, it's just fascinating for sort of reflecting on that sort of social side, really. And I suppose I just wanted to bring us back to the next steps for you, really. I mean, you've obviously done so much work that's translated into the chapter. What do you see as the sort of next pressing issues, sort of for research? Where are you looking, as it were?
So I suppose part of my research, or like a large part of my research now, is thinking about how trans and gender diverse identities intersect with other identities. So specifically, I'm thinking about autistic identities and ADHD. Again, we know that autistic people and people with ADHD are at higher risk of developing eating disorders. I know there's a chapter in the book that talks specifically about autistic people's experiences. So again, trying to understand whether for people who are both trans and gender diverse and autistic or have ADHD, what are their experiences like? We know there's a high co-occurrence between gender diversity and neurodivergence. So trying to understand, are there specific things that would be really helpful for trans and gender diverse people who are also autistic? Are they different for those people who have ADHD? What about people who are both autistic and have ADHD? I think trying to understand specifically what support is needed for those individual groups is where I think my next step is looking. I think in terms of the research more generally, I think we still have very limited sort of longitudinal research looking at how eating disorder symptoms develop, and then I suppose the trajectory in terms of people experiencing recovery. What does eating disorder recovery look like for trans and gender diverse people? We still don't really know a lot about that. But I think with trans and gender diverse people, it is really interesting to think about how different life events, it could be different elements of transition if they are pursuing gender transition, how those have an impact on the eating disorder, but also how people understand their identity. So I think there are specific things around social transition that would be really important to explore. So social transition is more sort of changing of clothing, changing of name and pronouns, hairstyle, etc. And medical transition is more to do with sort of gender affirming hormones or surgery. So how different stages of gender transition may impact on how people see themselves and their identity, and also how that's related to the eating disorder.
It's really interesting as we're sort of coming towards the end, as it were, that we're finishing on identity, and how you're sort of thinking about all of these various intersections and how we can need to understand this in a much more nuanced and sophisticated way of how these interact to understand really how identity plays a role.
Yeah. Well, thank you, Kai. I think that's a nice place to wrap up. It's been really fascinating. I feel like, obviously I've already, read your chapter, and there's obviously more detail about specific things in there. But really interesting to help, to see the links you make with the other chapters as well, because obviously there's a very intersecting area, isn't it? You've grabbed the bull by the horns, I think, with this topic, because there's so much complexity, but it's such an important field clinically. This is the kind of thing that people in eating disorder services, and I'd say people in gender identity service, and kind of services around neurodevelopment and so on, will find really useful. So yeah, thank you again for giving us your time today.
Yeah, thank you,
Thank
Kai.
you.
It's been really interesting. Thank you.
Thank you.